For you.
Okay. My mic is unmuted for you?
We can hear you, Dr. Lyon. Take it away.
Great. Thanks for having me. Little strange talking to a computer rather than people, but in the era of COVID, we'll make do. Um, you know, so this is something that I'm passionate about and enjoy talking to people about because it's something that we really have a lot of awesome treatment options, and we can really help people. It's unfortunately something that men don't really talk about much and don't really oftentimes want to address. So this is a really good format to be able to talk about it and to educate people about how we can really take care of this problem and fix this problem. So, not a lot of times will you find people eager to talk about the prostate, but certainly I am and happy to help people with it too. We'll cover prostate overview. We'll discuss an overview of BPH, and we'll talk about treatment options also. So, an overview of the prostate will start us off. What is the prostate? Most people don't even know what it is. It's basically a walnut sized gland that sits at the base of the bladder. It forms the first part of the urethra. The urethra is the tube that you urinate out of. And it also produces fluid that is part of the ejaculate. The prostate will grow to a normal size by about 20 years old and begins to grow during the 40s and increases in size over time. It's one of the only glands in our body that continues to grow throughout time. Because it's continuing to grow and forms the pipe that we urinate out of, it can wreak a bit of havoc by basically clogging up that pipe and causing trouble for us over time, especially as we age. What sort of things can happen to the prostate? Well, there's enlarged prostate or benign prostatic hypertrophy. There's prostatitis, which is inflammation or infection of the prostate, and prostate cancer. And each condition affects the prostate differently and is treated differently. We'll go into an overview of BPH. What is BPH? BPH is overgrowth of the prostate. It's the B in BPH stands for benign, non-cancerous growth. The prostate means relating to the prostate, and hyperplasia means overgrowth or more cells than normal. Essentially, an enlarged prostate. This can in turn lead to what we call bladder outlet obstruction and basically clogging of the pipe that leads out from the bladder. This leads to what we call lower urinary tract symptoms, meaning bothersome urinary symptoms. A lot of men will ask when they hear about BPH and they have an enlarged prostate, does this mean that I have prostate cancer? No, it does not. BPH is not prostate cancer. It is a benign growth, not malignancy. BPH does not cause prostate cancer. The symptoms of BPH can be similar to men that are experiencing symptoms from prostate cancer, in that both conditions can cause enlargement of the prostate. Benign prostatic hypertrophy can coexist with prostate cancer. PSA, which is prostate specific antigen level, which is used to screen for prostate cancer, doesn't always well distinguish between benign growth and cancerous growth. This slide goes over a little bit of the normal prostate versus the enlarged prostate. And this goes back to the problem of the clogged pipe. As the prostate enlarges, it clogs up the pipe that we urinate from as men. Some men can have a large prostate and it doesn't cause them much trouble. It doesn't cause them significant lower urinary tract symptoms. Other men, even a smaller prostate size, can have bothersome symptoms from that enlarged prostate and clogging of a urinary pipe. What are the symptoms that guys complain of? Most commonly, they'll complain of things like frequent urination, going to the bathroom frequently or the day or night. They'll say things like, I can't drive as far as I used to. I'm having to pull over. Or their wife will say, gosh, he's waking up all night and he's going to the bathroom. They can also get sudden urges to urinate. And that comes from the pump, which is the bladder, being overworked. And so the bladder becomes very muscular. And so this bladder is sort of a trained linebacker ready to push. But when it pushes, you've got a weak stream or a weak urine flow because the pipe is clogged. They also can complain of a feeling that the bladder is not really emptying, trouble starting or stopping, what we call hesitancy, where they have to wait to urinate. Okay, this can even progress to sometimes where guys have the inability to urinate, where they develop what we call retention. It essentially just shuts off the pipe, and they have to go seek emergency treatment to get that drained. Obviously, something we don't ever want to let men get to, but unfortunately, oftentimes they do progress to that. There's a lot of things and a lot of ways we could intervene way before that to keep men from that. This slide basically goes over how BPH can really affect quality of life, and that this slide shows that about 95% of the men who have moderate symptoms are unhappy and they don't want to spend the rest of their lives with these symptoms. And more than half of them say that it interferes with aspects of their normal life. And they'll tell you this from driving a car to sleeping and these sort of things, or even being able to watch a movie. About half of the men do say they experience sexual problems related to their lower urinary tract symptoms. And we even get complaints of this affecting people's partner's quality of life. We'll often get complaints from the wives saying, yeah, I hear him all the time. He wakes me up all night long because he's going to go to the bathroom. Who gets BPH? Well, pretty much all of us men are destined for this at some point as we get older. Some of us are earlier on the scale, some of us are later on the scale. But it's most commonly a problem for guys that are older than 50 years. By about 60, half of men are affected by this. And by 85, 90% of men are affected by this. So nearly every male is going to be affected by this. This, quotes a study from 2010 showing that as many as 14 million men have lower urinary tract symptoms. Other things that can increase the risk of BPH are obesity, higher body mass index, and lack of exercise. How is an enlarged prostate diagnosed? Well, it starts with a discussion of the urinary habits. And we always start with a medical history and a history of the symptoms that someone's having. But we also want to do a physical examination where we examine the prostate. We do things like check to make sure that the urine is emptying from the bladder well. And so we'll take a post-void urine volume test to make sure that a guy's actually emptying his bladder decently. We'll oftentimes check the flow to give some objective evidence of how the patient's urinary flow is. We'll use self-evaluation scores like the International Prostate Symptom Score, which is just a basic questionnaire that a man answers about how his urinary habits are, the frequency, the urgency, these sort of things. The great thing is that we have a lot of excellent treatment options these days, and a lot of treatment options that we didn't have, and a lot of treatment options that are very safe and very effective. And so this is not a problem that men have to just deal with. And unfortunately, I think a lot of men think that this is something that is just a part of age that they have to deal with. And that's really not the case. This is something that we have great treatment options for. And so we'll spend some time talking about that. What sort of treatment options do we have? Well, some of them are very simple in nature. Things like changing the diet, restricting the fluids before you go to bed. Those are easy, early maneuvers that we can do to help control some of these lower urinary tract symptoms and improve guys' quality of life. Moving on from there and their level of invasiveness, there's medications. There's medications to help the urine flow. There's medications to shrink the prostate. They're minimally invasive treatment options. There's steam therapy of the prostate or prostate lift. But the nice thing being that these are minimally invasive options that are very effective. There's also traditional surgical procedures such as transurethral resection of the prostate, an excellent procedure to open up that channel and actually shave out the inside of the prostate to get a man urinating better. And this is one of the traditional procedures that's been performed for decades. And when guys hear about a prostate procedure, this is kind of what they think of. And they think of their grandfather or their neighbor's grandfather that said, no, I had a roto-rooter, is what guys will often say, where the prostate was shaved out. Very effective procedure, but much more invasive, requiring hospitalization and general anesthesia. Whereas now we have a lot of other options that are much safer and very effective. Everyone wants to know about alternative medications. And so really, this slide sort of summarizes there's no dietary supplement or combination of phytotherapeutic agent or other non-conventional therapy that is recommended for the management of lower urinary tract symptoms secondary to BPH. This includes saw palmetto and urticaria. A little bit about watchful waiting. What is watchful waiting? Well, watchful waiting means that we're not doing an active intervention. We're not prescribing medications, and we're not prescribing any intervention besides simple sort of lifestyle modifications, such as adjusting the diet. Sometimes we'll see guys that are just taking in, something like coffee or tea that has caffeine, and with an adjustment in their diet, their urinary symptoms will improve and they won't need medications or they won't need intervention. Other guys who may be bothered by nighttime urination and a restriction of their fluid intake before they go to bed may improve them enough so that they're quite happy. Obviously, we don't want them to have symptoms that progress or symptoms that are unaddressed, especially since we have so many effective ways to take care of this. And usually when I counsel patients and they have these sort of symptoms that can be easily, I talk to them in general about BPH and about the prostate enlargement and how this probably will get worse over time, and that these are early maneuvers that we can use, and that over time they should be cognizant of changes, and that when we intervene early, it's easy for us to fix. When we intervene early, the body responds better. And so I do really encourage early intervention for my patients. And I think that gives them really the best outcome. What other things can be used? Alpha blockers. So these are medications that work on the actual muscle of the prostate to relax the prostate, open up that channel, and to allow a man to urinate more freely. These can be very effective in increasing the patient's urine flow, decreasing their frequency, and helping them be happier with their symptoms. Like any medication, they have potential side effects, including effects on blood pressure, dizziness or even fainting spells, fatigue, nasal congestion, and interaction with other medications. Usually not a problem for a young guy, because a young guy isn't on a lot of medications typically. But this becomes more and more of a problem as a guy gets older. as they get older, the medications are piled on. Antihypertensives, and each one of these medications can have more interactions. And that, from my standpoint, I see it as a failure if I have to A, put patients on medications, or if they have to stay on medications. And that's because there's so many good treatment options that can be done to fix the problem. That why these days, when we have so many effective, safe options to fix the problem, put someone on a medication for the rest of their life. And so this is where it is really fun to be able to take care of people and help them out with these kinds of things so that I can literally make sure that they don't have to be on these medications for the rest of their life. What other medications are there? There are medications that can shrink the prostate. Class of medications, 5-alpha reductase inhibitors. These are basically designed to try and shrink the prostate. And they affect some of the male hormones to shrink the prostate. It can shrink the prostate by up to 50% at about 6 months. The problem is that these can be associated with side effects, including decreased PSA levels that can affect prostate cancer detection, erectile dysfunction, lower sexual drive, and ejaculatory problems. And the alpha blockers also can be associated with ejaculatory problems. So I oftentimes don't use these for patients on a long-term basis because patients don't want to be bothered with these potential side effects. Moving on to minimally invasive treatment options. The Rezum, which is basically water vapor therapy, steam. It's a non-surgical therapy that we use in the office that treats the prostate and basically treats the obstructing tissue that's blocking up that pipe by water vapor, and essentially kills off that tissue that's blocking things and allows that to resorb and allows that channel to open up. This is done in the office. It does not require general anesthesia. It is very effective and is quite a game changer for patients to be able to have an option like this that can be done safely and effectively in the office without hospitalization. Here is basically a video that will go over how the Rezum works. And you can see here in this slide that what's actually being treated is this obstructing tissue here. And this is the obstructing tissue that is basically encroaching on that channel, on the pipe, and causing that pipe to restrict the urine flow. After treatment, that tissue dies off and the channel opens up and allows the patient to urinate much better, hopefully with an improved stream, decreased frequency, decreased urgency, less nighttime urination, in a very effective and safe manner.
Rezum uses the natural energy stored in water vapor or steam. Clinical studies support that Rezum relieves BPH symptoms safely and effectively, eliminating the need for BPH medications, while also preserving sexual function. During each 9-second treatment, sterile water vapor is released throughout the targeted prostate tissue. When the steam contacts the tissue and turns back into water, all the stored energy is released, causing the cells to die. Over time, your body's natural healing response absorbs the dead cells, shrinking the prostate. With the extra tissue removed, the urethra opens, reducing BPH symptoms. Most patients begin to experience symptom relief as soon as 2 weeks, and maximum benefit may occur within 3 months.
this shows that 97% of patients that have this done would recommend this to a friend when they studied this, meaning that the people that go through this are very satisfied and very happy that they've gone through with this treatment. Other things that we can use are transurethral prostate lift. This is also a procedure that's done in the office with a scope that uses basically implants to tent out the prostate, open up that tissue, and again, in a very safe, effective way to open up that channel of the prostate and allow a man to urinate easier. GreenLight laser therapy is a therapy that's used in the operating room to use the laser to open up the channel of the prostate in very similar ways to we've talked about before, but the idea is opening up the prostate. This is the use of a laser to do that, but this is used in the hospital with potentially more possible problems than some of the more minimally invasive therapies. This is a very effective therapy at opening up the channel of the prostate, and that they're men that require different types of treatments depending on their prostate anatomy, their prostate size, shape, and all these different factors that can change what is chosen by the patient and the urologist to optimally treat the prostate. Transurethral resection is a procedure that's been used for decades. And this is sort of the gold, what we call the gold standard procedure, because this is what other procedures are measured against. And it's a very effective procedure that actually we shave out the inside of the prostate. And when we shave out that inside of the prostate, it opens up that channel very effectively. The problem with that is that has to be done in the operating room with anesthesia, and can have potential side effects, including bleeding and incontinence, and possibly even affecting erectile dysfunction. Still a very effective procedure, still a procedure that I use and I choose for some patients. And what's really important is that working with a man to figure out what's going to work best for him and what's going to be the safest and most effective treatment. And for some men, that may be a transurethral thermal therapy. For some men, that may be prostate lift. For some, that may be GreenLight laser therapy. And for some, that may be transurethral resection. There's some people who perform some of these and not other than these. I perform all of these. And it allows me to really focus in on what's going to work best for the patient. And each one of these has their spot that is their real sweet spot, that they're very good at treating. And luckily, we have these as part of our armamentarium to take care of guys. And one of those is prostatectomy. This is more invasive, and that's actually where we core out the inside of the prostate, leaving just sort of the outside of the prostate. This was traditionally done through a lower abdominal incision. Nowadays, it's done with, oftentimes with the aid of a robot and little tiny tools, but a more invasive procedure, and a procedure that has higher risks associated with it. And so there are still, indications for this, and there are still guys that need a procedure like this. But my objective is to avoid a procedure like this. And my objective is to always see what's going to be the thing that's easiest for the patient to get through and most effective. Insurance coverage. Insurance coverage is always an issue, and that there are people in the office that are hired just to help with this kind of thing. Luckily, I don't deal with that very much. I try and figure out what makes the most sense. The insurance coverage, well, that's up to other people to help us figure out. But these things are very, very well covered. In summary, what is prostate and how does it work? Enlarged prostate and BPH. You have excellent treatment options. You have simple options for men that don't have much of a problem. And sometimes these can be fixed with simple dietary changes. There are some people that do prefer medications. And sometimes I do have patients that say, no, I want the medication. That is not what I prefer for them. I try and keep people off of medications, or I try and get them off of their medications. But some do prefer medications, and they're there for them, and they can be effective. There are minimally invasive options that can be done in the office with a simple scope procedure that are very effective and very safe, and have really changed the game for how BPH is treated. And Rezum is excellent at allowing me to be able to take care of people and use water vapor therapy in the office to safely treat them. And it's fun. It's fun to be able to take care of guys that come in struggling with a problem and get them fixed. And that's where me and my office really, get our pride from, is being able to take patients that are struggling with a problem and get them fixed and get them moved on with their life. And that's the fun part of medicine. And we have all these options, and we have all the traditional options and even the more invasive options. And these are all very good and all very effective options when used appropriately. And what it really takes is someone who really wants to look at all these options and is an expert at using all these options. And I've been in a center of excellence for Rezum for over 3 years. I was the first center of excellence in the entire Midwest. I'm a center of excellence for the Urolift. I'm the first person in the Midwest to use, aqua ablation of the prostate. I really pride myself on finding out what is going to work best for each man, because each man's different. Each man's needs are different. Each man's prostate anatomy is different. And what is going to do the best thing for them and be the easiest for them to go through is my objective. And the good news is we've got a lot of awesome things to take care of this. And men don't have to just deal with this. And that there are a lot of things that aren't going to affect them sexually, that aren't going to risk incontinence and these sort of things. And that what men traditionally think about dealing with the prostate doesn't have to be that way. And we can fix this problem. So what's the next step? Well, come and see me. We'll get you fixed. Okay. I don't know what's your next step, but let's get it investigated and let's get it figured out and let's get you back to a normal life.